Welcome to the Rhode Island Wave Spotlight Series. I'm your host, Scott Nerney. We're here at the Queesit Inn. Don't forget to like this, subscribe, send it to a couple of friends. This is some important information you're going to want to know for yourself, your loved ones, your family, because whether it's today, tomorrow, in the near future, gentleman John Gage is here to talk to us about long-term care in our nursing home facilities. Welcome to the Spotlight Series.
Thanks for having me, Scott.
Tell us a little bit about yourself and your position.
As you said, my name is John Gage. I'm the president of the Rhode Island Healthcare Association. We're a trade association that's part of the American Healthcare Association, and we represent 80% of the nursing homes in the state. So we have 63 member facilities out of 79 facilities.
So 79 facilities in the state doing nursing care of.
That's correct.
Then we're not talking hospitals, we're talking rehabilitation,
Skilled nursing,
assisted living.
rehabilitation, yes.
Okay, that's a lot.
It is.
Roughly how many residents does that cover?
There's approximately 7,500 residents that reside in nursing facilities or that are there for short-term stays at any given time. And
Wow.
currently we're about 86.6% occupied.
Wow,
So,
that's great.
sure. It was 90% before the pandemic, bottomed out around 70% in the heat of the pandemic.
Okay.
And we came back up to just over 86.5% now. So.
And a lot of people think of nursing home, I mean, there's obviously different levels. There's rehabilitation, someone who's had some situation like a hip replacement or some surgeries. But for the most part, it's really long-term care, whether it's physical needs or mental dementia and Alzheimer's. In the past, it was a lot of private pay.
Correct.
I assume it's changed a lot now. What's the percentages kind of breakdown?
It has changed a lot. 65-70% of nursing home residents rely on Medicaid to pay for their long-term care skilled nursing needs. Probably another 10-12% are Medicare or managed Medicare products. 5% managed Medicaid, like Rhode Health Partners through Neighborhood Health Plan of Rhode Island. And then the remainder, a small fraction, 5 or 10% private pay.
And when we talk about Medicaid, that is for folks who really have no other assets.
Right, they have less than $4,000 in assets.
Okay.
And then they contribute the bulk of their income each month, and then Medicaid picks up the difference between the federal and the state government funds.
So this is the tax dollars of the Rhode Island folks who are here, and some federal that's paying for the Medicaid.
Right, it's about a 50-50 match for
Okay.
Medicaid.
And how did we get to this point?
I mean, nursing homes have been around since the 60s when Medicare and Medicaid came along, probably longer than that in some iteration. I've been involved over 30 years. When I got out of Providence College in the late 80s, became a nursing home administrator and have run nursing homes or been in their corporate offices a little over 30 years. And just 3 years as the president at Rhode Island Healthcare Association now. We provide a mix of services. Long-term nursing care is the bulk of what we do, but then we also provide short-term nursing and rehabilitative care for someone that's had a stroke or that has had knee replacement or hip replacement, to get them back home using physical, occupational, speech, language pathology services, along with nursing care, and then all the life enhancement folks, the social workers, the activities directors that have programming throughout the day, to keep them involved and engaged in life.
And you do a lot of knowledge sharing between different facilities to help them coordinate?
We do. Yeah, Rhode Island Healthcare Association, we host educational events 2 or 3 a month. We have networking events with our members, and we have regular board meetings, and we're active politically at the State House, watching for legislation that might hurt us, or trying to get things passed that will help us.
And give us a picture of what nursing care was like pre-pandemic and post-pandemic now.
I think we're pretty much back to pre-pandemic in the nursing homes. As I said, we've returned to the occupancy percents nearly that we were before the pandemic, but again, a mix of short and long term. The largest struggle today versus pre-pandemic has to do with staffing. Staffing's always been a challenge. The funding from Medicaid is inadequate and has been for many, many years. But right now, our workforce is down over 16% from February of 2019. So just pre-pandemic to now, we're off about 16.1% of our workforce. So it's a real struggle.
And is that because the pay isn't good enough? Is it because people left the industry, like doctors and nurses, or is it a combination of
it's
not training enough people to go into it?
Challenging environment, especially for the CNAs on the front lines. And people have choices today more than ever before. People are working remotely from home. You can't provide hands-on care remotely. But people, during the pandemic, left nursing homes in droves. It was, scary place. The pandemic really was geared towards going after older adults with a lot of comorbidities, and that's the population that we care for. And several of the staff also got sick throughout the pandemic, and several actually passed away. So it was a scary place to work, hard work, and the money is a challenge. We're underfunded. We estimate 50-20% by Medicaid, and so providing that care and attracting the staff that's going to come every day and take care of the residents is a challenge. That's our biggest focus.
One of the things that the state's working on is there's two things. One, to the negative, but with good intention, was staffing level requirements, that they wanted to make sure there was enough staff to take care of the patients. And there were some fines that were about to be levied if nursing homes couldn't meet those, but they're having trouble hiring.
Right.
So those have been kind of abated for a while. And then the other side of that is Medicaid reimbursement to the nursing homes, where they were expected to increase with inflation or costs over time and hadn't.
Right.
So where do those two stand now?
Staffing mandate was passed in May of 21, became effective January of 22, and has been delayed in its implementation by 3 different executive orders by the governor. They set staffing minimums, 3.81 hours per patient per day of overall nursing care, and 2.6 hours of that a day provided by a CNA. Those metrics are quite high. They're the highest in the country, actually. And it was passed with no additional funding. So we're already short funded by Medicaid. Then they pass a staffing mandate for enhanced staffing on top of the staffing that we were already providing, but didn't provide any additional money. So just kind of heaped, loss on top of loss.
And if that was a city instead of a nursing facility, that would be called an unfunded mandate, right? Which would get a lot more press.
Right, and it would get paid in the next budget cycle.
Right.
So, yeah.
So if the fines are still held until we can get proper staffing and hire people, but the reimbursements are increased a little bit, does that take enough pressure off to where we're not going to have nursing homes closing? Or?
Well, we estimate that there'd be about $80 million in fines in the first year that the staffing mandate was fully implemented. We have not been assessed any fines at this point, but they start at 200% of the labor shortfall in the first quarter of noncompliance and go up to 250 for the second, 300% for the third and fourth. So we grow to about $81 million. Obviously, that will have a devastating impact on us. We estimate that we were underfunded by $50-60 million pre-pandemic, and then add another $50 million on for the staffing mandate. So we're $100 million short, and we're threatening fines. We're being threatened with fines of $80 million. So we've been fortunate that the governor, the speaker, and the Senate president have agreed to pausing those fines at this time. And we're hopeful to get the underlying statute revised so that it's more doable. Obviously, we want to provide good quality care, and we're held to account by the Department of Health every day for the care that we do provide. So, we're hopeful on that front. On the Medicaid front, the governor's budget came out earlier in January, around the 15th. It includes a 6.6% inflation index that would increase our rates by 6.6% October 1st, 2024. And they're also going to, for the first time, look at the actual cost of care in 2022 and then change the Medicaid rates to reflect the allowable expenses in those Medicaid cost reports that each facility fills out. The last time that was done was 2012, using 2011 actual costs and we got an average increase in that 10 years thereafter of about 1% per year. So our expenses, obviously exploded, especially
Sure.
during the pandemic, but we far outpaced the inflation index that we were supposed to get, or that we actually got, in the 1% per year. They passed it in 2012, and there were 4 or 5 years in a row we got zero out of the gate. So,
And even in the last year, you look at the inflation rate.
right,
The
of
last couple
everything.
of years,
Yeah.
the food that you're having to buy, the laundry detergent,
Yeah, medical
the
supplies, energy,
Yeah,
property tax.
yeah.
Yeah, labor.
Wow.
And then labor's the biggest.
And what is the average? Because I know people don't really, hear all the numbers. What is the average price for someone who's in a facility, not rehabbing, but more long-term care?
I would say average Medicaid reimbursement is about $290 a day, and the average cost of care, I hear, ranges from $350 to $400 a day. If someone's in the facility on Medicare, involving all the therapies and nursing and wound care supplies and all kinds of medical supplies, the food, the lights, obviously, it can be as much as $600-700 a day. When you layer in all those ancillary expenses, their medications, what have you. In the past, we had a shortfall on Medicaid, and we would make up that shortfall with Medicare residents, with private pay residents, who would be paying more per day than the estimated cost. That hasn't worked for a long time. Private pay is predominantly in assisted living now, not nursing homes. And Medicare, more than 52% of Rhode Islanders who qualify for Medicare are on Medicare Advantage plans through insurance companies like United Health, Blue Cross, Tufts. And those rates per day are much lower, $200 a day lower than what Medicare pays. So that gap funding just doesn't exist anymore. So
the folks who are listening now and watching this, what can they do to help? Can they reach out to their legislative leaders?
Sure, absolutely. We'd welcome them to get involved in the political process, to lobby on behalf of nursing homes. If they're a licensed nurse or a nurse's aide, come on in, get a job application. We'd love to have you. People are involved in nursing homes in a lot of different capacities, either being on staff, being a family member, being a resident themselves, or being a volunteer. So, we'd obviously welcome that as well.
And a lot of our folks in Rhode Island have skills that, even on a volunteer basis, if they were a teacher or a crafter of some sort, I would expect a lot of the facilities would welcome those folks to come in and,
Sure. Yeah, we have
and work with
recreation
their staff.
directors, recreation staff, activity staff that come in and, run structured programs with the residents, in-room visits, but crafts, things along that line. And the volunteers oftentimes participate in that part of the programming. We really have like a whole city of staff. We've got food service workers, cooks, food service manager. We've got the activity recreation folks, social work, maintenance, housekeeping, laundry, in addition to all the clinical staff, and the therapists.
It's a whole city.
It really is. It really is. It's quite the undertaking to run one of those facilities.
But John, I really appreciate you coming in, and your facts cold. I appreciate that.
Yeah.
The fact is, we really need to help the nursing homes and facilities and rehab facilities to keep them whole. Otherwise, we'll be looking at a lot of them closing, and beds won't be available, and staff still won't be available.
Right.
And we need to kind of turn that tide a little bit. And folks, you really need to pay attention to what's going on out there. Contact your local legislators. Make sure they're aware of this. And we really need to see a little light at the end of the tunnel. It looks like we have a little bit moving forward this year.
Yes.
But it's a long path to go to make sure that people and facilities will be here to take care of us when we get there. Because odds are we might get there.
We might. We're getting closer every day.
I know. We are. We are. Thank you very much.
Thank
really
you.
appreciate it.
Appreciate it.